right, it is time now for our Better Pets.
You know, November is National Diabetes Awareness Month for both people and pets. Dr. Andrea Dennis from the Bloomfield Animal Hospital is here to talk about the condition in our animals, including how it's diagnosed and how it's treated. Thank you so much for being with us.
Welcome.
Oh, my pleasure.
You know, we think a lot about diabetes and how to prevent it in humans. You don't really think about it as much in cats or dogs or pets. Does it affect them the same way?
Very similar, and many times the way their symptoms are also very similar. But 1 out of every 200 cats actually have diabetes.
And how can I tell if my cat drinks a lot?
They tend to drink lots of water,
Okay.
and a lot of them tend to be overweight too. You'll see from, like, we have this little kitty here that was actually a little bit on the heavy side, and they'll go to the bathroom a lot. They'll urinate quite a bit too, and sometimes they'll lose weight unexpectedly, even though they're eating a lot. So those are some of the symptoms. In dogs, we see 1 out of every 300 dogs have diabetes. Now you can tell that little guy is a little bit heavier than he should be.
Yeah.
And these are actually patients that do have to get insulin. But so weight control is really very important. But yes, if you see your dog or cat all of a sudden urinating in abnormal places, you know, we've talked about that too, when they don't really go in their litter box all the time. This is one of the things we check for. We want to rule out that they don't have diabetes.
Here's some of the symptoms, I guess.
Yeah, they sometimes are just weak. Sometimes you'll see your dog or cat stumble, and then you don't think about it for a week, and then you see him stumble again.
Yeah,
they'll act very fatigued or weak.
Okay.
You're always filling the water bowl, so they drink lots of water, and then of course they have to go to the bathroom quite a bit too. Sometimes waking you up at 2 in the morning to take your dog out. And again, as I mentioned, they'll eat a lot, but they're losing weight. So this is why you need to bring, when you see these symptoms, it is so important to bring them to your veterinarian, because of the fact that the earlier we treat diabetes, the better it is for them.
This is going to be, it might be a dumb question, but I know there's type 1 diabetes and type 2 diabetes in humans.
Yes.
The same thing with animals?
It's kind of, sort of. So, you know, dogs generally have what we would consider like the type 1, which is where the pancreas is totally destroyed and you have no capability of making any insulin, and that's why you need to give it. In cats, it's a little bit more like type 2, but it's not exactly the same. But we use those as comparisons quite often. And again, but the same treatment, you must give them insulin, and usually it's twice a day.
Twice a day.
Also, you say diet and exercise. A dog, I can see you take the dog for the walk. How do you make a cat exercise? I don't know how to make a cat do anything it doesn't want to do.
It's a kitty treadmill.
You know? We talked, you know, you can like throw balls, you know, those little those little
assuming they want
trampolines.
To chase it.
Yeah, that's true. The laser, I love that laser light. You know, you get
they
them
like
going.
that, yeah.
But you know, we do have to be a little bit more creative with cats than with dogs. And again,
my Brooks Brothers tie on the bed last night turned out to be my cat toy of the day.
Yeah.
See? But sometimes we don't think about it, and that's the main thing. If we can get them to lose a little weight, a lot of cats will not end up with diabetes. That's the big thing about it. And again, I think when we have to treat diabetes, you know, we need to go ahead and give them insulin. This is actually some B12, vitamin B12. That's why I wanted to have it in red. And I just wanted to show you that it's very, very easy to just draw this up and get a little bit of the fluid right. Oop. I think my needle's going to break a little bit. But when you do that, then the needle is so tiny that you barely see it. Yeah. And that's what you want to give into the patient. So if we go like so, we just stick that right inside and then just give them a nice little shot.
Twice a day.
Twice a day. They generally do very, very well. And I would say 50% of people that hear they have to give an injection panic. But by the time they get used to doing it, your veterinarian will guide you through it. It's very, very well. You want my little guy?
Yeah.
So the other thing that's really neat is you can actually do a blood test. I don't have much time, Scott. And a lot of times you have to do a blood test at home. Now, first I want people to be able to feel comfortable giving the insulin. But if you had to do a blood test at home, they make these nice little, this is an alpha track 2 reader. And actually what you do is just, again, that little small little point, and you actually just inject that into the ear.
Into the ear?
Yeah, there's a right at the ear margin. Can I have my doggy?
Absolutely.
I'll show you. So what happens is if you can just go ahead and right in the ear margin is a little vein right there, and you just pop that, and then you take your alpha track reader and it will you just put that right up against that little drop of blood.
It's just like people.
Just like people, and it will tell you exactly how. I'm sorry, I'm shaking a little bit. It will tell you exactly how much insulin you should be giving based on the blood glucose.
We have
so it's all treatable.
We're out of time, but we just want to make sure real quick. Thanksgiving, scraps on the table, not to the dogs and cats.
No scraps. That's nothing fatty, and again, no raisins, no grapes. Those type of things are
no
really
chocolate.
Very good. No Kara knows no chocolate.
Thank you so much.
You're welcome. Thank you.
And as a reminder, Dr. Dennis is the owner of the Bloomfield Animal Hospital on Old Windsor Road in Bloomfield. You can visit her there.
On alternating Saturday afternoons from 2 to 3, she's taking listener questions during Pet Talk on WTIC 1080 radio. So tune in for that if you can. Very